Good afternoon, everybody, and welcome to the City ICP Share and Learn session. I'm really delighted today to be able to welcome Andrew Redfern, who's Chief Executive, and Apollos Clifton Brown, who many of you will know is Director of Health and Social Care, to the Share and Learn session. Framework have been a key part of supporting some of the most vulnerable in our city for a long time, and been really crucial in some of the work we've been doing across the ICP and really sort of key partners. So it's a great opportunity to learn a little bit more about them, what they're doing, but also then obviously we can have some conversations at the end. So they're going to do about 15-20 minutes of slides and presentation, then we'll have a little bit of time for a Q&A afterwards. So without further ado, over to Andrew and Apollo.
Well, good afternoon, Hugh. Good afternoon, everyone, and thank you for that introduction. Yes, Framework began really in the form of two predecessor organisations back in 1970 and 1971, and they were called Macedon and Nottingham Help the Homeless Association. They began really with the concern of local people, particularly churches and faith-based groups, about literally people sleeping on the streets who died in that very cold winter of 1969-70. And really that's where it all started. And those two organisations came together in 2001 and created what we now know as Framework. And in this first slide here, there is a description of our vision, which focuses on homeless people, vulnerable people, excluded people, and our vision is a better future for them. And there's a list there of the main client groups that we work with, because what those early sort of pioneers discovered was that homelessness was not just a matter of people not having anywhere to go or not having a roof over their head. In nearly all cases of certainly of single homelessness, there were many other much more deep-rooted issues involved, and that list is an indication of those. So we're working with all of those groups of people, and often people who have several of those coexisting at any one time. And what we're trying to do is to empower them, to help them to address the challenges that they face, and enable them to be part of our community, to live in it, to sustain themselves in it, and to fulfill their aspirations within it. So perhaps, Mars, if you could move us on to the next slide. So this is, what we are. And we're not just a registered charity, we're a company limited by guarantee and indeed a registered provider of social housing. So you might ask, why are we all of those things and not just one? And it's because the issues that we are addressing are very often multifaceted. As I explained earlier, it's not just one issue. Often it's well, nearly always it's a person who has a multiplicity of issues that they face, and we need to be able to respond to that in a sophisticated and joined up way. So we clearly are a charity, but for instance, we also need to be able to attract loans from banks, grants from statutory organisations, non-statutory organisations, and we also, as a big part of what we do, offer housing. So we're a registered provider of social housing, and that means that we, in a sense, have several identities. And there's actually quite an interesting sort of culture difference between the culture of charities and the culture of housing associations, which we try and bridge and we try and bring together. And that theme of kind of bringing things together, I think is a big part of what Framework is all about. We operate in Nottinghamshire, Lincolnshire. When with the little shire in brackets, that bit really means that we operate in the cities, so in the city of Nottingham and the city of Lincoln, but also right across those counties, in North Lincolnshire, based in Scunthorpe, in Derbyshire, Leicestershire, South Yorkshire. And we have 1,350 units of accommodation. What we mean by that is one place where someone can live. That might be a self-contained flat, it might be a space in a hostel, but we're able to house round about 1,350 individuals at any one time. Those people that we house tend to be the most vulnerable of the people that we serve, because almost by definition, they're people who it's hardest for other landlords to house. In all those areas, we have more than 1,000 employees, and in the year to last March, we had 18,500 separate service users. That's a rounded up figure. I think it might be 18,445. If you add those figures up next to that on the right, I think it comes to slightly less actually than 18,500. But that's the order of it, and they are all separate individuals. And the way we describe our work is we divide it into 4 pillars. Now, it's a bit of a joke within the organisation because I often find myself saying 4 pillows. I don't know what that indicates psychologically, but it is pillars, P-I-L-L-A-R-S, on which we base our work. And of those, 2,724 people used the housing pillar. They were the people that we actually accommodated. But you'll see that the others, the health, the employment, the support and care, and those are people that we worked with in the community, are larger overall. So although people may think of us as a homelessness organisation, a housing-based organisation, yes, that's a really important part of what we do, but actually we work with more people that we don't house than people that we do house. The people that we house are probably the most vulnerable, as I said. And because we do this wide range of things, we're regulated by different organisations, not just by the regulator of social housing, which is the kind of housing association bit, but also by the Charity Commission, and also increasingly by the Care Quality Commission. And I think on occasions even Ofsted have a view on us because of the education and training work we do. So we sort of work with a lot of different stakeholders, commissioners, and also with a number of regulators too. Perhaps Mars, you could move on. So this is just a graphical representation of those 4 pillars. Why do we have such a range of work, and why do we describe it that way? Well, essentially, what we've discovered over many years is that where people have a range of needs, trying to just address one of them and hoping that the rest will take care of itself tends not to work. And so what we look to do is to, so a good example would be, a homeless person who clearly needs somewhere to live, but also has quite significant, let's say, mental health or alcohol and drug issues, and actually has never had a job. So the responses we need to offer to that are not just about providing them with the right kind of place to live, but also ensuring that those health interventions happen, and also that we're working with them to enable them to be economically independent and to make a contribution to the life of the community, and hopefully be paid for that. So that's why there is that breadth of what we do, and you'll see there listed, some of the different things that each of those pillars consist of. So we do a wide range of work, and that's sort of constantly changing. Having said that, and I really want to emphasize this, it's not necessarily about the work that we do. We tend to try and identify things that aren't happening that need to be happening and fill those gaps. But ideally, the mainstream services and services provided by other organisations, if they are well enough tailored to the excluded people that we're working with, then we're happy, and we don't need to have a direct intervention of our own. Very often we find that with the most excluded people, services are not tailored to meet their needs, and that's where we will try and do something specific. So Mars, if you could move on to the next slide. Yeah, that just sort of gives you an idea of 2 things. One is, what I've already spoken about. So I've got the correct figure there. It's not 18,500 last year, it's 18,425. So I'd overstated it by 75 in rounding it up. But you see the balance there between the different pillars, the different things that we do. And again, emphasizing that point that only, probably less than, what is that, less than 20% of the people that we're working with over the course of a year, are we actually accommodating most people? We're doing other things with a range of sort of preventative work and complementary work. The bit at the bottom, you'll see how the number of people we've worked with has grown over the years. You know, back to 2001-2, which is when Framework began as the merger of Macedon Nottingham Help the Homeless Association. You'll see the growth there, which in a way is sort of the opposite of what we would want, because ideally we are working towards a situation which I suspect will be many years in the future, where actually the kind of work that we do isn't necessary anymore, because the systems work so well and so quickly, and they intervene soon enough so that people don't have the kind of, you know, levels of exclusion that they have. That's the ultimate vision. I think at this point I'd like to pass on to my colleague Paulus Clifton Brown, to give him his official name, who will talk a little bit more about the detail of some of the work, but also how that links to the work of the ICP. Polo, and Mars, if you could move to the next slide.
Thank you, Andrew. So the next slide shows the concentration in different areas. So Andrew explained that we work across the East Midlands, but in reality, we have the highest concentration of those pillars within Nottingham City. You can see from the colours on there the different pillars and where they're provided. Bearing in mind, what we're really attempting to do here is to ensure that there's adequate provision across all 4 pillars. Can we move to the next slide, Mars? Okay, so let's look at Nottingham City. So this is by far the best example of complementary services across the pillars. In many ways, I think Nottingham, partly to do with strategic partners, I think partly to do with, there's a lot of people interested in this area of work. There's a lot of, I think, detail known about the citizens that we have and where they are across partnerships as well, that it just seems to work better. I think the strategic relationships are really strong, and we value that, and I think our partners value that as well. There's specific things that bring together and formalise those strategic partners, so where we're working towards the same goals. Some specific services as examples, obviously Nottingham specialises in severe multiple disadvantage. We'll talk about that again a little later, but SMD is essentially anyone who experiences 2 or more of a mental health problem, substance misuse problem, homelessness problem, and criminal justice problem. So the research in this area suggests that if you experience, you're disadvantaged with 1, and that disadvantage is compounded massively with 2, and it gets to the point where single services are no longer the answer. Actually, you just can't move things forward appropriately. Building better opportunities is another massive partnership with lots of stakeholders involved, of which we are one. Nottingham Recovery Network is the substance misuse treatment service for the city. That's a partnership with Notts Healthcare Trust and Double Impact. Small steps, big changes across the city, and we are a smaller partner within a large network looking at early years work. And I think all of these things actually complement each other and very much, I think, play to our strengths and our aims as well. So what we're attempting to do overall is to improve access to services for some people who find those services hard to reach. Andrew talked about influencing strategy and commissioning, highlighting gaps and barriers, and where necessary, providing services directly. In a sense, it's better described as systems change. It's extremely difficult to do on your own, and in fact, it doesn't work on your own. I think that was a very, very early lesson for us. And as Andrew also explained, the ultimate aim for us is actually we're no longer needed as a charity. Can we go to the next slide? So if we look at how that works in the ICP, I can't describe how enthusiastic we are actually for the work of the ICP. I think the collection of strategic partners across the city to look at our population needs, to look at those being left behind, the level of detail and understanding who they are and where they are and what they experience, I think the laser sharp focus on where the gaps are and where people struggle to get in and where they fall out is phenomenal, and we absolutely want to be a part of that. In fact, we've chosen to be a part of that as soon as we had the opportunity. Our ultimate principle that actually we want to wrap services around people rather than individuals, the idea that people's chances are optimized by addressing multiple needs at the same time, rather than sequential treatment through service after service after service. That just doesn't seem to work for us at all. The ICP absolutely believes the same thing, actually. I think that vision that multiple partners working together can get further and we can bridge those gaps, and that's music to our ears. It's one of the bits to bear in mind, I think, when thinking about our cohort, so the people that we're there for, we call them beneficiaries. All of the ICP priorities affect them directly. So every part of what the ICP does is relevant to our work and relevant to our charitable goals. Severe multiple disadvantage is one of the priorities. We lead on that priority, the exec sponsor for that priority. We've moved resources from Opportunity Nottingham. We've shifted around some of our own services to help support it. Notts Healthcare Trust are the other lead in that priority, and I think what it has managed to achieve in a year could have taken decades, I think, without the ICP being able to accelerate that level of work. Care leavers, which is another ICP priority, we support some care leavers, and we know that a lot of care leavers have experienced adverse childhood events. We know the proportion of those will struggle and will end up homeless and will end up our beneficiaries in the long term. Pathways that are better for them is central to this working. We know the people we support struggle to access mainstream healthcare, which means they struggle to access flu vaccinations, even though the average life expectancy is around 55, and most of them have quite compounded underlying physical health problems. So improving flu vaccinations for that cohort is central to what we need to do as well. We have a massive percentage of that cohort smoke. We know that it's compounded in areas of deprivation, and it is difficult to get more compounded deprivation than if you are literally street homeless. We can see this in BAME inequalities as well. There are various bits of work we do specifically around that. Being able to support a system-wide approach to improving that access inequalities is really important to us as well. The development of a strategic partnership that can focus its gaze and improve pathways is really what we've been trying to do for some period of time. And a COVID response that takes into account people that could be considered hard to reach. Again, they are exactly the same. I think we're quite grateful for how closely the ICP, those strategic partners together, their priorities mirror our own. We look forward to what that means over the next year. There are various community services that we provide that are likely to be re-engaged at PCN level. So we're looking at how our primary care work with mental health social prescribing or alcohol treatment or some of the family mentor services better support PCN specifically as they strengthen under that partnership as well. And I think we're really excited to see how this develops, and we're really excited to know that all of our staff, along with all frontline staff, are members of this thing, which actually appears to be getting stuff done. Next slide. Okay. Is it a picture of some of the buildings? I think when we do build houses, just to say that we try and ensure that they're good quality homes. Everyone deserves a chance, and the better home you give them, the better chance they have of doing that. I think I will draw it to a close there.
Thank you very much, Paulo and Andrew. That was a really interesting talk, and certainly I learned some some bits I didn't know in terms of the breadth of your coverage, but I quite like the four pillows, Andrew. That's fine. So we've got about 5 to 10 minutes, and I put one or two questions there. So I'll kick us off. The first question: 1,350 accommodation units. Are these sufficient for the demand you face?
In a word, no, they're not. And quite a lot of them are kind of legacy units that we've inherited some in the past from other housing associations, some that we've been able to develop ourselves, where we've been able to do it purpose built. So A, they're not enough in terms of numbers, and B, they're not all of the kind of quality that we would ideally want and to which we aspire in the future. But I think this is also an example of how we can't do it all on our own, and I think it links also to a question that you, I think, have asked, Hugh, which is how do we work with Nottingham City Homes, who are one of the other members of the partnership. We need to have partnerships with lots of organisations, but in particular with housing providers, whether that's almost like the City Homes or housing associations, indeed private landlords, because we need a supply of stock that we can move people into, either directly if they're ready and able to live independently, or having sort of been through some of our specialist supported housing, maybe because they've had mental health issues or substance issues or whatever. So this is, in terms of the accommodation, this is a very good example of us not being able to do it all ourselves, and we really concentrate in housing on the people who are in the greatest need the most support. But as I say, we need that supply of much more conventional accommodation, move on accommodation, that we can kind of tap into. And the City Homes are a very good example of an organisation we work very closely with. And typically what we will do, so we have, for instance, under the Rough Sleepers Initiative, revenue funding from the Ministry of Housing, Communities and Local Government, to support people in accommodation, in mainstream accommodation. So we'll be able to say to the landlord, look, we can offer support to help this person to ensure that they'll be able to maintain their tenancy, they will be paying their rent, they'll be getting on with their neighbours okay, if you can actually make the home available. So that's really important. But there's always a need for more and better quality accommodation for those that others can't house, and that's why continuing housing development is an important part of our future strategy.
Thanks, Andrew. That's really helpful. And you mentioned, goes one of my other questions, you mentioned revenue, and obviously lots of charities, lots of areas have been hit with demand from COVID and revenue issues. How's it working out for Framework? Presumably there's quite a lot of stresses and sort of stuff, and I'd be interested about your revenue streams a little bit, understanding that.
Well, we're very fortunate in that a lot of our revenue comes from two main sources. One is literally the rents and service charges that we're able to charge to people living in our homes, and while they may be unable to pay for that themselves, they are entitled to housing benefit, and that will generally cover their rent and service charge. So that's a reasonably stable source of income, which hasn't gone away as a result of COVID, so that's really helpful. And also another big source has been contract funding with mainly local authorities. City Council's a big one, the Nottinghamshire County Council, Lincolnshire County Council, Sheffield City Council, a number of others. And again, that has remained in place through the period. So that's given us a level of stability that's enabled us to concentrate on what have we needed to do in order to continue providing services and keep people safe through the pandemic. And that there's been a lot we've had to do around that, because like other organisations, we've had staff shielding, we've had outbreaks, we've had to kind of rethink our operating procedures to make sure that staff and service users are safe. But fundamentally, we've not been able to stop, because the people have still needed those homes, they've still needed our support. So we've just had to find different ways of doing it, and sometimes those have incurred additional expenditure. And we've had some support from the big lottery fund. We've had some emergency grant funding, and essentially we've managed to get through the year, and we've managed to remain reasonably financially stable. But that's been with a lot of support from our partners, and we've particularly appreciated support from ICP members, public health, and others who have really kind of held our hands a bit through this, and come in with support with things like testing and now vaccinations. It's been really good that we've been able to get a lot of our staff, our frontline staff, vaccinated, which gives them a greater sense of security. And now we're moving on to service users as well, because many of our service users do have significant underlying health conditions. So another really good example of the value of partnership in helping us all to get through this and continue serving vulnerable people.
Thanks, Andrew. And perhaps time for one last question I can see on the post. So somebody said, great to see the ICP priorities are all aligned, but what has been the impact?
Do you want to have a go at this, Polo?
I'd love to. So what has been the impact of the priorities? So I can pick out two. So if we pick out the SMD, which is the one that we've led on, so let's talk about the actual impact. So we were trying to bring people together to address multiple complex needs for some time through a lot of money through Opportunity Nottingham, millions of pounds, and it kind of got us so far. However, you still end up with a large proportion of people, especially those street homeless, perhaps with a drug and alcohol problem and a physical health or mental health problem, stuck. I think to the point where we would be the only people supporting them, or it would often feel like that. The SMD workstream specifically has pulled the organisations together to actually do something really coordinated. The beginning of the pandemic, which I think actually sped this up, we managed to put everyone who was street homeless into a hotel. We managed to give them all a physical health check. We got them all registered with GPs. We moved some of them onto tenancies, which I think before COVID and before this coordinated response, we wouldn't really have believed you could leap from one thing to the other, but it worked. We did full bloodborne virus vaccination. There's a testing and treatment, literally everyone in hotels. And when the hotel model finished, we looked at how we would progress that really intensive multi-organizational response, of which Framework is only one part. That is now being joint commissioned. That's the plan over the next month or two from the CCG and the local authority together. We'll see a multi-agency partnership out of that, so multi-organizations partnership out of that. And the outcomes from the actual beneficiaries is part of a formal evaluation currently, but we can see that people have progressed in ways that we would not have seen before that point. This is early days. This is in 1 year. And we already have a completely different model for supporting people, small number of people. We have a different way of commissioning those services, and we are evaluating and changing what works and what doesn't. The other priorities are progressing in very similar ways, but obviously I can speak to the one that I sponsor. The ICP has changed how the sticky stuff is addressed just phenomenally.
Thanks, Paolo. That's really helpful. And as you say, one of the key things the ICP is for colleagues on the we know is all the programs are going to have proper evaluations. So, we know, the bottom line is we've got to show improved outcomes for our citizens, haven't we? And we aim to show that. So it's 1:30 dead on the dot. So I'm following Tracy's lead because she always keeps these dead to time. There is another question there, but rest assured we will pick that up because we do respond to all the questions, I promise you. So can I thank Andrew and Paolo for your time? It's been really interesting, really helpful. As ever, the ICP is more than happy to have ongoing conversations if people have things they want to sort of bring to us and sort of chat with us. But then just to sort of flag up, so the next Share and Learn is on the 18th of March, and actually relevant to this, obviously, it's Nottingham City Homes and Richard Holland, so hopefully you'll see you there. So thank you very much, Paolo and Andrew, and thank you everybody for joining us, and we'll see you on the 18th. Take care.